So, a man came to the hospital. He's an elderly man in his 70s. So, he went somewhere and had his blood pressure checked, and it was on the high side. So, he came to the hospital to confirm whether or not his blood pressure was high. And when we checked, we realized that his blood pressure was on the high side. And it was so high that we needed to put him on medications. And he said that when I gave him the prescription, he said that doesn't mean I'm going to take drugs for the rest of my life. This is a man in his 70s worrying about taking drugs for the rest of his life. It's commonly seen among patients that they worry about taking drugs for life. Patients don't like to hear taking drugs for life, or you will be on drugs for life. They have this, it gives them bad mojo to feel that way. And some, when they are placed on drugs, they say that they don't want to start taking drugs, either for hypertension or other diseases, that once they commence drugs, they are definitely going to be on drugs. They won't be able to stop it. And so, two things. One, taking drugs for life and whether drugs can be stopped or not. Now, think of it this way. Life is not fair. Life is not fair. Do you know that there are children that are born with diseases? From early childhood, they are diagnosed with a disease that they have to treat for the rest of their life. The rest of their lives. Is that fair? It's not. Many children are born healthy without diseases. But to now see a child being born with a disease, it's not fair to that child. Take, for example, there are children that are born with diabetes, usually called type 1 diabetes. So from early childhood, that child has to be on medications. It's not fair, but the child has to be on medications. And throughout adulthood, for the rest of his or her life, he or she has to be on drugs for diabetes. It's not fair. But should the child or the individual say, oh, it's not fair, so I'm not going to take drugs? No. We agree it's not fair, but it is the way it is. Right? So, from childhood, they start taking drugs till the end of their life. There are those that are born with sickle cell disease that they have to be on drugs or regular care for the rest of their life. There are those that are even born with HIV/AIDS, and they have to be on treatment for the rest of their life. So, first thing is not fair. Life is not fair. And as such, there are certain situations that will arise where we will need to be on medications. Now, people don't like to hear the word for life, taking drugs for life. So, and one can stay away from using that word. So what they need to hear is that you have a certain condition and you need extra medical attention for life. You will need to be more vigilant about your health. You need to take your health more seriously. You need to see your doctor, or go to the hospital for regular checkup. So more vigilance, more health care for the rest of their life. Without necessarily saying that they have to be on drugs. because situations might change. There are situations where the drugs will be changed. There are situations where if under certain circumstances, the drugs can be stopped temporarily while the patient is being observed. So those situations exist. So instead of telling a patient that you take drugs for the rest of your life, you say you need more medical attention and more assistance for the rest of your life in order to live a healthier life, in order to improve the quality of your life. And to note that this more medical attention doesn't mean that you live worse off. No, the more medical attention you receive would ensure that your blood pressure is taken care of, your sugar level is taken care of, your blood cholesterol is taken care of, and all that. And it will prevent or prolong, postpone, or delay the arrival of complications like stroke, complications like heart disease, complications like kidney disease, and all the other complications that can come from having some of these chronic medical conditions. The other thing, which I've partly addressed, some say that if they start drugs, they won't be able to stop it. That is not necessarily the case. There are some times where, if a patient comes that has hypertension, for example, if the blood pressure is not too high, the patient can be put on lifestyle modification. That is without drugs, non-pharmacological management, where he'll be asked to lose weight, to reduce salt intake, do regular exercise, watch diet, and all of that within about a month. So if within a month those changes have not been able to reduce the blood pressure, and the patient may need to be on medications. Now, even though the patient is now on medications, right, there are certain circumstances whereby the drugs may be stopped, such as if the patient's blood pressure has been stable for several months and the patient is instead of taking more than one drug, the patient's blood pressure is being well managed with one drug, which is monotherapy. The patient is on monotherapy, his blood pressure is stable, and it doesn't have those long-term complications of hypertension. Those complications are not there. Complications that will require more treatment, those ones are not there. In such circumstances, and the patient has, improved on lifestyle modifications, so the drugs can be stopped gradually and under medical supervision. So, which is very important. Self-titration of drugs is not recommended for hypertension. What is self-titration? Self-titration is when the patient is on medications, on antihypertensives, and the patient on his own adjusts the drugs or stop taking the drugs because he went out to check the blood pressure and the blood pressure is better, and on his or her own stop the drugs. Self-titration is not recommended because evidence doesn't show that it's beneficial to that patient. So the patient can do self-monitoring of the blood pressure, having a blood pressure measuring device at home to check the blood pressure, but adjusting the drug on his or her own is not recommended according to the national guideline. So if there need to be changes to the medication, it has to be under medical supervision. So the patient has to come to the hospital and consult with his or her doctor. Also, under medical supervision, the drugs could be reduced or stopped for a short time, and the patient given a short appointment like 2 weeks or a month, then the blood pressure is checked to see if there is an increase in the blood pressure. If the blood pressure still stays okay, patient can be kept on regular appointment for blood pressure check without the medications being re-prescribed. But if the situation arises later that the patient has to be put on the drugs again, the patient will be told to do so. So the point is, the most important thing is the treatment has to be under medical supervision, and what the patient needs is regular checkup, regular medical checkup. It is during those checkups that the blood pressure can be checked and his drugs reviewed, and other conditions that could arise as complications of the disease could be checked. And regular tests and screening are done to check for other conditions that could be related or coincidental with that primary disease that the patient has. So regular checkup is the key thing. And so the concept of I'm going to take drugs for life, it's not about taking drugs for life. It's about having more medical attention for the rest of your life, going for more regular checkup because of the condition, and also under qualified medical supervision. Sometimes those drugs could be stopped and recommenced when the situation arises. A lot of things are put into consideration. The ability of the patients to be able to come for checkup is important, and the ability of the patient to understand the instructions and to follow them. All those things are important. So the point is, the misconception about, if I start drugs, I won't be able to stop, or I have to take drugs for the rest of my life, and so I'm doomed, shouldn't be the case. Because at the end of the day, what do we want? We want to improve the quality of our lives, and improving the quality of our lives sometimes involve taking medications, sometimes involve going for just checkup without medications. But the most important thing is for you to maintain regular medical checkup. And if there is need for you to be on those medications, and if there is need for you to be on those medications for a long time, and if there are side effects or adverse effects of those medications that are setting in, the doctor too will take note of that. If there are need for changes to the drugs, it will be done. If there are need to changes of the dosages or the dose of those drugs, those things would also be done. And so there are people who, as I've mentioned earlier, there are people who have been on medications from childhood, and they're doing very well. With HIV/AIDS, for example, there are people who have been on medications for several years, and they are doing well on those medications. Their quality of life has improved. If they don't tell you they have HIV, you won't know, because quality of their life improved with the medications. So the medications, did they make them doomed for life? No, it improved the quality of their life. So also with sickle cell anemia, those who are on regular checkup and on regular medications, it improves the quality of their life. And other chronic medical condition, with regular checkup and regular care, the quality of their life is improved. And that's what we want. Ultimately, what we want is to improve the quality of our life, and so that we can live a better and healthier life with or without medication, but with proper regular checkup.